evening, everybody. My name is Mkhize, and I head up the Corporate Relations Department at ITHUBA Holdings. It is my pleasure to welcome and greet all of you this evening. I would like to acknowledge the Honourable Minister of Health, Dr. Zweli Mkhize, Deputy Minister, Joseph Pahla, ITHUBA Chairperson, Mr. Seth Palatsi, the National Lottery Director, Mr. Brendan Burns, ITHUBA Executive Committee members, the CEO of the Bank of China, Mr. Tao Li, Head of Growth at Mara Smartphones, Mr. Sylvester Daku, CEO of Engine Petroleum, Mr. Yesa Hassan, members of the media, and all distinguished guests. On behalf of our Group CEO, Ms. Charmaine Mabuza, it is our honor and privilege to have you all present at ITHUBA this evening. Just to take care of the house rules, the ladies and gents are out the door to your left. If we can please observe cell phone etiquette, if I can ask everybody to have their phones on silent. We are also live on Twitter and welcome you to live tweet and post as we go along. Our handles are at SA Lottery. Without wasting any further time, I'd like to welcome on stage Mr. Seth Palatsi to give us the opening address.
Thank you very much. Greetings to Honourable Minister Mkhize and Honourable Deputy Minister Pahla. And we are to expect Minister of Police who will arrive very soon. Distinguished guests and members of the media, I stand before you as the chairman of ITHUBA Holdings, the national lottery operator, and on behalf of our group CEO and our group chairman and the board of directors of ITHUBA, the executive team and all the employees of ITHUBA, including the corporate social investment team that has been responsible for this media, you are welcome. The COVID-19 virus is by far the most hard-hitting pandemic the world has ever had to battle. A battle that has brought everything to a standstill so that lives can be preserved. We have seen devastating effects of this virus in our country, especially in vulnerable communities where South African livelihood has been lost and as a result, the inability to afford basic needs. South Africa has been blessed with leaders that truly care about people. We have witnessed the measure put in place by President Cyril Ramaphosa and his cabinet to ensure the health and sustainability of South Africans. Essential workers across different fields continue to show up every day and serve the nation selflessly. And to you, ministers in our midst here, your efforts, your interest, and all that does not go unnoticed. And you need all the help you deserve. We are a country that is centered on the spirit of unity of Ubuntu, especially in the critical times. It is in that same spirit that ITHUBA has raised its hands to support the Department of Health and the South African Police Service with a total of 100,000 reusable face masks, ensuring the safety of our essential workers who are at the forefront of this battle is really at least we can do. It is our way of saying we recognize you, we thank you. We trust that these face masks, which have a lifespan of a year, will make a significant difference. Now, in conclusion, I have in front of me here how the SAPS one will look like. Doesn't look like your head, Minister, but we tried to match it somehow. And then we have the one that will be worn by the health people. And as we said, these are reusable and can last for a year. Now, in conclusion, let us continue to abide by the rules and regulations prescribed for us by the government, adopting high-class hygiene standards and staying at home. South Africa is a resilient nation. If we support the efforts of our leaders and play our role as citizens, responsible corporates, and the media, we will survive and come out stronger. It shall pass. Thank you.
They make it so that no one.
Thank you, Mr. Palazzi. Let's not waste any further time. Can I call up on stage the CEO of Bank of China, Mr. Tao Li?
Thank you. Honourable Dr. Mkhize, Honourable Minister of Police, Honourable Deputy Minister, good evening. It is indeed an honor to be invited to attend this evening ceremony and be part such a noteworthy cause in assistance in your department in the role you are fulfilled in the fight against Corona-19. Your department efforts on the ongoing commitment to the health and the well-being of all South Africans is nothing short of laudable. As part of corporate landscape in South Africa, Bank of China are immensely provided to be afforded the opportunity of playing our part and assisting to your department. As you may be aware, to date, we have, without hesitation, donated PPEs to the Howden MEC of Health, Department of International Relations and Cooperation of South Africa, and the City of Johannesburg Metropolitan. We are always view our social responsibility in South Africa as a key value within the organization. And as one of the largest foreign banks licensed in the country, we're proud to be able to join the government efforts in some way by donating much needed resources. It gives me immense pleasure that our consignment to your department will include 100,000 medical masks, 600 protective clothing, and 5 ventilators to where it is most needed to combat this pandemic. Besides, as part of financial system, Bank of China will continue to provide essential financial service to help our clients fighting the virus and survive through this hard time. Thank you. Take care and stay well. Thank you. Thank you.
And now let me welcome on stage the Head of Growth at Mara Smartphones, Mr. Sylvester Daku.
Good evening, Honourable Minister of Health, Minister Mkhize. Good evening, Deputy Honourable Minister of Health. Good evening, Honourable Minister of Police, Mbeki Clearly. And for all the honourable guests, all protocol observers, good evening. Marathon South Africa commends the brilliant work. I'm just going to take it off for the mic. Marathon South Africa commends the brilliant work that has been done by the Department of Health, the government of South Africa, and the fortitude that the frontline workers have shown in the combat of this COVID-19 virus. In this time, more than ever, it's very important and imperative for people to stay connected whilst they're isolated at their home and confined at their home. To be connected and to be informed of everything happening within the countries and to keep in track with obeying the pandemic regulations. And as such, Marathons recognizes this and has donated 500 smartphones to the Department of Health towards its assistance to help these frontline workers who are sacrificing their lives, their time, and putting themselves at risk for the benefit of all South Africans during this period. Marathons is helping in two ways. It's the donations of the 500 smartphones and also pledges to any organizations and to the public who are willing to donate phones to support the frontline workers, to support the government, to stay connected. It should be appreciated that the smartphones are not only for connectivity when it comes to the essential service workers and the frontline workers. These smartphones can also become a tool of service for the Department of Health as a tool of diagnosis in the frontline work that they do. So for us, this support goes a long way to assist the department in its effort. On the pledge side, the reason why we've decided to also say for anyone who wants to pledge and also donate smartphones towards this pandemic, Marathon is willing to subsidize this, significantly subsidize this, the purchase for towards the donation. It's because during this period, the sacrifices that our frontline workers are offering is impacted the entire economy. And for those who can afford, it becomes imperative if they can contribute for us to then further subsidize this. A little background of Marathon South Africa. We are the only manufacturer of smartphones in South Africa. And it was a company that was established in South Africa on the 17th of October 2019. Towards this effort, we know that the economy has taken a huge knock during this period, and hence creating jobs, real jobs, in an industry like smartphones that impact on the fourth industrial revolution becomes very, very important for the country, and it's a top priority for the government. So just a symbolic handover and really a commitment of the effort that the government has done thus far.
The CEO of Engine, Mr. Yusa Hassan, couldn't be with us tonight, but he has sent us a voice note for us to listen to. Thank you, technical.
Minister of Health, Dr. Zweli Mkhize, dignitaries, all protocols observed, ladies and gentlemen. Good evening from Cape Town. Firstly, please accept my apologies for not being able to address you in person this evening. We are all living through unprecedented times. Many of us are anxious about what the future holds, how the pandemic will unfold, and the effects it will have on our lives as individuals, on our families, on business, and the wider economy. I personally share these concerns and challenges with you and our fellow South Africans. As Engine, we are taking measures. We continue to support the communities in which we operate, care for the well-being of all our employees, and customers, and begin the learning process to adapt to what is likely to be the new normal in the months and years ahead. We know that our well-being is intrinsically linked to the well-being and prosperity of wider society and the nation. This is why you can count on our support in the battle we all currently face. I have no doubt that the COVID-19 pandemic will be overcome collectively. Engine was designated as an essential service when the national lockdown was announced by President Ramaphosa in late March. Our service stations continue to provide essential fuel and convenient services to South Africans over the course of the national lockdown. We have noticed over the past 42 days, many dedicated essential workers, including frontline healthcare workers, have dropped by our forecourts day and night to refuel or pick up a snack. We are truly honored to be here for them in this time of need. And while we applaud all workers, we have continued to serve through these trying times. I would like to pay special tribute to our frontline health care workers who are selflessly giving of themselves for the national good. They are the true heroes of the day. On behalf of Indian family, we are humbled to play our part in support of these frontline healthcare workers. Our 1 million rand in fuel contribution to the Department of Health will be used to fuel the emergency response vehicles used by frontline healthcare workers in the days and months ahead. This vehicle will transport healthcare workers to where they are needed most. As Indian, we applaud their unselfish commitment and bravery in helping contain the virus and saving lives. I would like to take the opportunity to commend Dr. Mkhize and the South African government for the urgent and comprehensive manner taken to manage the pandemic and to safeguard us all. While the path ahead is uncertain, we at Indian firmly support your measures to ensure the health and well-being of this great nation. We are also humbled by the work of the many NGOs, businesses, as well as individual citizens who are pulling together to combat the pandemic. As South Africa Petroleum Company and cognizant of our role as a responsible corporate citizen, NGN is committed to supporting the communities in which we operate. To support social distancing while refueling your vehicle, NGN has launched our very own NGN One app, a digital fuel payment solution where you can make contactless payment for fuel from convenience of your vehicle. Other than being a gateway to the future of convenience motoring, it truly helps in ensuring we take all necessary care for our customers at the engine service stations. In this time of crisis, we know that our support is more important than ever. Our fuel contribution to the Department of Health is one of various fuel and financial contributions we are making to various beneficiaries to ensure we overcome COVID-19. As a designated essential service, we also continue to safely meet South Africa's petroleum needs. Our service stations, manufacturing facilities, and distribution network are all focused on the task of slowing the spread of COVID-19 through heightened hygiene measures that comply with both the Department of Health and World Health Organization standards. The path ahead will be difficult. It is uncharted territory for us all, but together we will succeed. I once again would like to thank Minister Mkhize, the Department of Health, and the South African government for the excellent measures taken to ensure the nation's health and well-being. I would also like to thank the Department of Mineral Resources and Energy Minister, Mr. Zweli Mkhize, for the support given to NGN in the course of this pandemic. We continue on the path taken with this disease. On behalf of the entire NGN family, I wish everyone good health and safety. And thank you for your time this evening. Please stay safe and take care.
Thank you for Mr. Hassan. That was the CEO of Engine. I would now like to ask the Minister, the Honourable Minister Zweli Mkhize, to join us on stage.
Thanks, Program Director, the Chair of Palase, Program Director, the Chair of the Bank, Honourable Minister Zweli Mkhize, and Joe Parker, the Deputy Minister, and all dignitaries that are here. Well, you put me, unfortunately, one is combat ready, as our environment should be always combat ready, as we are here. I can't really measure the excitement we are having as the South African police. We are not a very small organization, Chair. We are 197,000 strong organization. But people that would be on the front line at any given time, there will be 30 to 50,000. Now, as I'm coming here to receive this beautiful gesture that will help many members of the South African police, as by the way, they are frontline, like the health workers, sometimes even more frontline than the health workers. You will find all of us on the road to work together on the road. And today we have a very, very busy night tonight, very. Because at 23:59, we're shutting all the borders of the provinces. If you haven't crossed your border at 23:59, you will stay in the border, in the province, wherever you are, until level 4 goes. We don't know when level 4 will go. So we are quite busy, stopping, searching those cars coming in. We are not immune to the challenges that are there. Up to this point, we've got 205 members of the South African police that have been infected. Unfortunately, 174 of them come from Western Cape, and the rest comes from the rest of the country. And surely, National Commissioner, and as we distribute this beautiful gift from yourselves, we'll remember that Western Cape, we need to make the extra effort there. This helps a lot. I go to a lot of roadblocks. Sometimes this becomes wet because members are sweating there, working and doing everything. And sometimes people complain to say, don't come too close to me and all that. About 2 days ago, we had a case where police wanted to arrest somebody. They asked somebody to go to the van, and he refused. The police had to push him to the van and say he's going to charge the police for breaking the rule. The social distance for coming close. So those are the things sometimes that you come across. But sometimes we have to give some members of the public some of these things because you realize that they might be put the police themselves and everybody in danger. So we hope this will help us a lot. I heard you talking, saying that they've got a lifespan of about a year. That will help really a lot. But also it will help to identify our members. That is not just somebody that we don't know, but is a member of the South African police. You can't wait. Definitely. That once it have this, then it's a trademark that is very prescribed for some kind of the people, not everybody. So we're very proud of that. But having said that, let me salute the members of the South African Police, not only them, and all other members of the security forces, the South African National Defence Force members, the Metro Police and other enforcement agencies that are doing the wonderful job. They lead, they tell us what to do, but we see to it that is done, because they can tell and people don't go otherwise and go other way. Our job is to see that everything that is going to help us is done. Sometimes it's a really serious work to mop up. People are told not to do that, they still do it. Not to sell alcohol, we still find a lot of it out there. Don't drink, they still drink. They don't smoke. No, they don't smoke. We have made sure that they don't smoke. So maybe I'll take the opportunity of just demonstrating this South African Police Service one, so that the police from now on, they know that they have this a beautiful one. This is SABS, so I put it this way. It seems very comfortable with your strap, a little bit elastic, so it doesn't stick too close. It doesn't stick too close. Take care of social distance. I don't want to be arrested here. This one, and then I come to this one. And then it's here with the police, and the police are here, and that's fine. And then you have coffee with a cop. That's all good. So the safe cop, coffee with a cop. Thank you very much. Thank you, Dr. Mkhize, for remembering us, but also thanks to the chair. Thank you very much.
Thank you, Honourable Minister Mkhize. And now I would like to call up on stage the Honourable Minister of Health, Dr. Zweli Mkhize.
Thank you, sir. Sure. We have intelligence.
Somebody lend me a mic. Thank you very much. Thank you very much. Our host here is Seth Palati, the chairman of ITHUBA, and the whole ITHUBA family here. Minister Pegicele, Minister Pegogwake Hamilton Cele. The Deputy Minister, Matume Joseph Pasha, the leadership from the Bank of China, leadership from Maraphones, the leadership of Engine, and all the other guests who are here. We want to say thank you very much for having us this evening. We also want to pay tribute to the members of the media who are here with us. You've always been around with us. When the police are busy up and down, or the health workers are up and down, the media is similarly up and down there, making sure that the story of South Africa is told. We want to say thank you very much for that. I think before we proceed, it is also appropriate to also pay tribute to our Commander-in-Chief, the President, His Excellency President Cyril Ramaphosa, for the very bold and sterling leadership that he's done for the country. He is there to guide us. He's there to take the difficult decisions and sometimes to nudge us on to move on. And where we are as South Africa, We are aware we're going through a difficult time, but I think his leadership is assuring every now and again when he stands up there and he sends a message to people in South Africa, everybody looks forward to that. So we want to say thank you for that leadership, because it would have been more difficult to deal with a complex challenge such as this outbreak, which is a global pandemic, where we're not being led appropriately by a leader who listens carefully, weighs all the advices, and has got his heart with the people. At the end of the day, what decision has to be taken, he says, we need to think about our people. And I really want to say that that leadership has made us all strong. So when we are here as foot soldiers, when we are faced with the challenges that we are faced with, we get stronger because of that leadership. So we want to salute President Cyril Ramaphosa for that leadership. I also want to salute all the frontline workers, our healthcare workers in particular, the nurses, the doctors, those who are in the various professions, community health workers, and those who are volunteers in the community. The community health workers, the volunteers, members of non-governmental organizations, the churches, traditional healers, and various other professions, the allied professions who are out there who are taking care of our people. All that we are seeing today is their commitment, is their dedication to caring for our people, and we want to say thank you for that. In the same vein, I join Minister Zweli to salute those of our members who are in the front line, in the security teams, from the police to the military, the South African National Defence Force, to the Metro Police, and the different security personnel. They make sure that our people are safe. We want to say thank you for the work that they've done. And I think to us today, this donation that has come from ITHUBA is actually adding a new color to the whole fight, because what is our challenge now is that all those who are in the front line, they need to be themselves exemplary. They must wear the masks. They must also be able to say they can secure their own health by ensuring that they've got a mask. The fact that this can last for up to a year is actually a good investment for us, because it means that people can have their own, wash it, and then reuse it. That is actually a new culture that we are seeing in the country. And of course, it has now generated a whole new business. I was saying, complimenting Minister Zweli, it really fits him, this particular page. And I hope he's going to say this one looks good on me as well. But the point is that we have seen now a lot of creativity, where people have gone out to do masks in a fashion. You have a shirt with a mask, you have a head duke with a mask. It's really become nice now. It's like, really, it's a natural thing. But if anybody of us would have said to us in January or in February, or even beginning of March, that will be by the end of April, all of us wearing masks and sitting far apart from each other, we wouldn't have imagined it. So a very short space of time, this COVID-19 has really created a huge change in our lives. So we want to thank the Bank of China for all the contribution that they've made. 100,000 medical masks, 600 medical disposable protective apparel, and other ventilators, and all that has been given to the provincial government of Gauteng. We want to also say thank you to the Maraphone. Indeed, Maraphone is the only phone that is manufactured in Africa, and being manufactured here in South Africa, we really appreciate this. We have also had other mobile companies, mobile phone companies, who have also made contributions. We want to say to all South Africans out there, particularly the private sector, we do appreciate your support, your partnership. We want to say thank you very much for that. And so from where we sit, we do want to encourage others to come on board, to be able to give us support on a continuous basis. The advantage of having these cloth masks for health workers now is that they can wear this on their way from home to work and put it aside when they've got to now start using the PPEs, which is this type. It is not going to be possible to have so many masks every day to give to our people as they need to carry the mask as they move from work to home. That's why this is very, very handy. And so we are also beginning to pick up other challenges. If you deal with the mask in the context of a hospital, we dispose this as a kind of medical waste material, which has to be treated in a particular way because it could be infectious, and therefore we have to dispose it in a particular way. Now, we have begun to pick up challenges where these are now finding their ways in the dump sites, and we actually do want to encourage people to use the cloth mask because these are firstly biodegradable, but also they don't need to be disposed of immediately. They can be kept for much longer, and as we have said, for a year. So we want to encourage as soon as we get this distributed, as much as possible, we'd like our members, when they get onto their taxis, if they're on their road, en route going from home to work, and so on, they can have a different mask to wear. When they get to work, that's when we keep the surgical mask, the N95, and so on, specifically the PPEs for those particular conditions, because we grade them according to the risk at which the person is exposed. And so from that point of view, we would like to encourage that our people must use the cloth mask, and then we keep this as much as possible because there's a high utilization rate at this point of these masks in the hospitals. Having said so, we also do want to say once again that all the work that has been done is really because of those of our workers who are dedicated and committed, and we want to continue to thank them for all the work that they have done. We also want to thank our people for coming on board to be ready to be screened and to be tested, and we have got very good cooperation. So for this evening, as we are looking at our numbers, we're continuing to see a slight increase in the numbers. In this case, we have the latest numbers positive is 8,232. That means for the Eastern Cape, we've seen increase to 929, and for the Free State, 134, and Gauteng, 1,804. In KwaZulu-Natal, 1,204, Limpopo, 41, Mpumalanga, 59, Northwest, 40, Northern Cape, 27, Western Cape, 3,994. Now, what we are seeing in the Western Cape is what we call cluster outbreaks, the hotspots. Most of the metros are showing us what we're calling the hotspots. That means we have to find mechanism to go into those areas to deal with these particular outbreaks more strongly to reduce the rate of spread. Because Western Cape at this point is just below 50% of the total. Now that means we have actually got areas of outbreaks in a number of areas, particularly when I talk about the factories, some of the shopping centers, shopping complexes, and so on. So we will be visiting Western Cape to give them support, and at some point during the course of next week, the President also will be paying a visit as he has been going around visiting various provinces, and that helps to strengthen our teams on the ground. So we will be working with them, and we will be going to look at what additional reinforcement needs to be done in the Western Cape. We are concerned about the fact that we need to try and rein in the increases that we are seeing there. Having said so, though, the rest of the country has got the spread of infection, which is not the same. So whilst we are at this point all level 4, but when we have to go into an intensive intervention, you will find that there's going to be differentiation in terms of how we deal with all of those areas. Some of the areas, like we're talking about Limpopo, Mpumalanga, and so on, they have not had such an increase. In some of the days, they don't record a single patient who's positive, and then, of course, you get sometimes 1 or 2, and so the approach will ultimately be differentiated once everyone is ready to be dealing with it. We will continue with the public screening, which at this point has enabled us to test up to about 292,000 tests, 153 tests. And these are particularly in addition to those people who would have gone to hospitals. These are others who have referred because we have been out there testing and screening the community, as it were. At this point, we have actually had over 7 million people who have been tested, who have been screened, and out of whom we've got that number. We still have to increase the testing beyond that point. Regrettably, we have to again report some loss of life. We report 8 more COVID-related deaths, 2 from KwaZulu-Natal, 6 from the Western Cape, and this brings the total to 161 the number of people who have passed. And again, we wish to convey our sincere condolences to the members of the family and the loved ones. We do also want to convey our gratitude and appreciation to the staff who did look after those. So all in all, we have now 161. In the Eastern Cape, the total would have been 18, Free State 6, Gauteng 15, KwaZulu-Natal 40, Limpopo 3, and then Western Cape 79. So that takes us to 161 of the people that whose lives have been lost. Having said all of this, we have also noticed that most of them are associated with what we call comorbidities. It's going to become a lot more important for us as we move into easing the lockdown, that we emphasize on hand sanitizers, on washing the hands, on putting on masks, on social distancing, on making sure that we practice cough hygiene. All of this is going to become our new normal, as it were. So we can see that in a number of places, in some instances, people are not seemingly taking it seriously. We do want to plead with everybody that it's going to be to the best of our own interest to heed the call to keep the distance. What we worry about is that if we don't do so, after the lockdown, we can suddenly have a sudden shoot-up of infections simply because of the way we are neglecting managing the prevention and containment measures as they should be. That is the only way. All the countries that have been able to succeed to reduce or contain the spread of the infection have succeeded because of that change of behavior. There's no magic. There's nothing else that can be done by the doctors or nurses. It's up to us to take individual responsibility for our own good health, to make sure that we support everyone else and prevent each one getting an infection from that point of view. With that, I want to once again say we appreciate all the partnership. I want to say thank you to the companies, to the business leaders that have come to give us the support. And as we move from here on, we send a message again to say, may we request all the others to join in and create this partnership that we need to fight COVID-19. I'll also do the same. I'm going to wear mine as well. Thank you very much.
put some science on Mary.
Yeah,
If this one.
the trick.
And there is the Health Minister, Dr. Zweli Mkhize, as he was receiving personal protective equipment for health workers from various companies in the private sector. And the Police Minister, himself also giving an update on how the country has been dealing with developments, especially in law enforcement, as we are now just almost 1 week full into level 4. Let's take a quick break. We'll return shortly.
We know you're out there in the front lines and we appreciate you and we see you. I would now like to close the evening by saying, please stay safe, stay home, and thank you very much. Good night.